Hi, good afternoon, everyone. My name is John Frassinelli. I'm a division director here at the State Department of Education. On behalf of the department, I want to welcome you to our webinar this evening. We have a very full agenda, so we'll get right into it. I just wanted to acknowledge all of you on the call. We had initially arranged for up to 1,000 folks to participate today, and you far exceeded our expectations, and we're up to over 2,800 of you are on, not counting the folks who are watching on YouTube. So thank you so much for joining us this evening. We did, just so you know, we did receive hundreds of questions ahead of time. And you can imagine that in an hour we wouldn't be able to answer all those questions, but we have taken all of those in and we've sort of condensed those into some themes that our panelists will specifically address related to your questions and concerns. So with that, it's my pleasure to introduce Commissioner Charlene Russell Tucker, recently named the Commissioner of Education by the State Board of Education and the governor, but she is certainly no stranger to the department and certainly no stranger to supporting our students and our schools, certainly our strong supporter of our students' physical health, emotional health, and also their nutritional health, as I will have to say that she is a registered dietitian as well. So spent her career in support of the health and well-being of students. So it's my pleasure to introduce Commissioner Charlene Russell Tucker.
Thank you so much, John. And I would say good early evening to everyone. Greetings to those of us on Zoom today and an extended hello to those watching via live stream. And I know folks are still coming in based on the numbers that we have. But just to give you a little bit of background, around this same time last year, the department, in our great collaboration with CERC, held the first virtual house call because we recognized the many questions and concerns families had about health and safety as students return to school, regardless of the learning model. And here we are again. So we have once again partnered with medical professionals to have your questions answered directly, because we recognize the continued value in hearing directly from our medical professionals or doctors during this time. And with that, I really want to give a huge thank you to and acknowledge our partnership with Connecticut Children's, Drs. Ketter and Salazar, and thank you for being here and for the dedication you show to our students' health and well-being every day. And also represented our school medical advisors and the American Academy of Pediatrics Connecticut chapter, Dr. Dudley. Shout out as well to all our school medical advisors and our school health professionals who are in there every day, really looking out for the health, safety, and well-being of our students. And certainly my thanks to CERC for facilitating this house call, as well as the department team, Judy, Dr. Carson, John, for your efforts in organizing tonight. And although not represented in our panel, I must and continually do a big shout out to the Connecticut Department of Public Health for their ongoing collaboration as we work to ensure that our districts are prepared to implement the suite of mitigation strategies in our Connecticut schools so that they continue to be as safe as possible for students and also for our school staff. Unfortunately, I cannot stay on for the entire call, but I really wanted to make sure I was here to welcome you to this virtual house call and to assure you that we're committed to working together with our districts, our partners, as you see here as an example, and our families to ensure a healthy and safe return to in-person learning so that our students can learn best and have access to the many supports that our schools provide. And so thank you for your interest in being here. As John mentioned, for those of you that may have come on a little bit after he started, with over 2,800 of you registering and with over 300 questions asked, we recognize how important this is. And we're really here to support you in every step of the way so our students can literally thrive in this upcoming school year. So I'm promising you that I'm leaving you in good hands. And so with that, I'll turn it back to John.
Thank you so much, Commissioner, and thank you for joining us this evening. So you've met our panel briefly. So with that, it's my pleasure to introduce Ingrid Kennedy, the Executive Director of the State Education Resource Center. Again, another wonderful partners. We couldn't do this without all of our partners, and it's my distinct honor to introduce to you our facilitator for this evening, Ingrid Kennedy.
Thank you so much, John. Good evening, everyone. It's so wonderful to be before you today, and a pleasure to be the facilitator for this session. Thank you to our colleagues at the department and to our expert panelists today. It is very evident that by the number of requests to be able to be part of this session, over 2,800 has been mentioned a couple of times, and the fact that we are also streaming this live, it is evident that the safety of our children, our educators, and our communities is at the forefront of every single one of us as we start another school year. So because we have so much on the agenda today, we receive over close to 400 questions. It is very evident, as has been mentioned, that we cannot answer every single one of those questions. So what we have done is actually group those questions to the level of those things that feel that you really want to hear about today. So that's what we have done with our expert panelists today. We have prepared some questions. In addition to that, you're going to be able to chat directly with them. So as they are answering some of the questions, if you other questions that you want to ask of them, they will be able to monitor the chat and address some of your concerns directly today as well. So with that said, we are going to go ahead and start our session today. So we have, it's a wonderful pleasure to have Robert Dudley, Dr. Robert Dudley, Dr. Robert Ketter, and Dr. Juan Salazar. So just to start today, because of the topic, the need, I'm going to start actually with a warm-up question to each one of you. So the first question that I would like to ask to all of you is, as you introduce yourself to the audience today, if you can just share with us your why. Why did you say yes to be part of this conversation, of this house call to our families? So I'm actually going to do this in alphabetical order. So I'm going to do Dr. Dudley, if you don't mind answering, just introducing yourself a little bit, and then just answering the question, why did you say yes to this particular house call?
Thank you so much for that nice introduction. So my name's Rob Dudley. I'm a general pediatrician in New Britain, Connecticut, where I actually came fresh out of residency 25 years ago. I've served as the school medical advisor for the city for the past 25 years, and then more recently as the immediate past president of the American Academy of Pediatrics. So I think why I've become so happy with these sessions and came back for this one after last year's is really the chance to talk to families. I think now that we're a year and a half into the pandemic, I really worry about the fatigue that I see setting in for folks. And I'm hoping we can have a great conversation about how we can build up resiliency in our communities, how we can support our children and our families and our educators, and continue what I think has really been amazing work reaching across disciplines and across different state agencies to create a safe environment for our children, but also to help them succeed. Because I think as we start to think about the pandemic as an ongoing event, it's important to say, what can we do? And to see the bits of light that I hope people will see at the end of this.
Thank you so much, Dr. Dudley. Dr. Ketter.
Hi, thank you for having me back. My name is Rob Ketter, and I'm a developmental and behavioral pediatrician at Connecticut Children's. I've had the privilege of walking with many of my families through clinic, many students who access special education services, students and families with disability, and typically developing children as well. And it's been a ride for 18 months. And I'm hoping that by being here, I'm able to reflect and represent some of the concerns that I've heard from families in clinic, but also to help understand how we can navigate through that. As Dr. Dudley said, it's been a long 18 months, but we've gotten 18 months in and things are looking better on the horizon. It's just we're hitting that stretch. So I'm happy to talk and chat and answer questions and talk about, like Dr. Dudley said, how we can really promote resilience and think about focusing on wellness and what's in our locus of control and what we can do to keep supporting our children through these times.
Thank you so much, Dr. Ketter. Dr. Salazar.
Yeah, thank you. And again, thank you for this invitation. I immediately responded yes for a variety of reasons. The first one is just a brief introduction. I'm a pediatrician trained in infectious diseases for children and have been involved with taking care of kids with COVID-19 that have been in the hospital. We have taken care of over 150 kids here at Connecticut Children during the past 18 months. So it's been a long road. It has not been as difficult as my adult colleagues have seen because they've had thousands of people hospitalized. But the effect on children has been dramatic, not only with the infection, but also the effect on their mental health. And we have seen many kids who have been, and young adults, by the way, who have been brought into Connecticut Children's for care of issues related to their overall wellness, mental wellness. And so this is something that I have seen firsthand, my colleagues have seen firsthand. I've also spoken to many members in the community, many of the families here in Hartford, where Connecticut Children's is located. In other locations, I've gotten thousands of calls from people, from parents concerned about their kids. What do you do with the kids? Now, what I have noticed throughout this very difficult pandemic time is that families here in Connecticut have a lot of resilience. You have put up with a lot. It's been very difficult, sometimes confusing. We've given you one recommendation, we perhaps change it the next day or the next week. The CDC says one thing, somebody else says something else. Part of that is we're learning with you in this process. It's not because we want to hide anything. It's only because we learn in the process, and we got to be humble enough to understand that we have to change the course. The message I want to give you today is one of optimism, one of resilience, one of moving forward. One that I've used is a quote that I've used often when I communicate with our team here at Connecticut Children's is that be not afraid, but be cautious at the same time. And I think if you follow those rules with common sense, you will make it through and we'll help you. And hopefully this webinar today, this presentation will answer some of those questions that you have. So really happy to be here. Hang in there. We'll make it through together.
Thank you so much, Dr. Salazar. Thank you to all of you for that opening response to all of us as we participate in this webinar together. And I know that we are really anxious. I see a lot of the questions already coming up to all of you. So we have also selected a few questions that we want to directly ask to each one of you. So I'm going to ask my colleague, Judy Carson, who is providing us, who has orchestrated a lot of this session today. If we can put up the first question that we want to ask our expert panelists. What can we as families do to keep our children safe at the beginning of the school year, especially children under 12 and those who are medically fragile? So if you will, any of you can start, so feel free.
I'm happy to begin with that question, Ingrid. And again, let me split this into two ways. For kids over the age of 12, I will very strongly recommend that you go ahead and get them vaccinated. The Pfizer vaccine, which was approved today fully approved by the Food and Drug Administration today, is one that has great safety, great record of efficacy, and it is available for kids over the age of 12. So here in Connecticut, only about 50% of those that are 12 years and old, 12 to 15 have been vaccinated. So we have a long way to go. So that would be my first recommendation to you as a parent. Trust the system. These are good vaccines. They are really effective. It's something that we in the past would not have had as easily as we have right now. So use them. Now for kids under 12, hopefully those vaccines will come soon enough. I am hopeful that, sometime over the next couple of months, they'll be available for kids 5 to 12, 5 to 11. So that will then begin to close the loop. So that's the first thing you can do. As a family member, you can get vaccinated as well. If you're vaccinated, you're going to create a bubble within your home, which will keep your kids safe as well. So that's sort of a responsibility with your own children. And then the common sense things that you need to do, which we've been saying from the beginning of the pandemic. Clearly, as these masks are very effective in preventing transmission in the community. So when you're bringing your child to a location with a lot of people, I think the mask is something that will be very effective until they're vaccinated and even after they're vaccinated. So common sense, wash your hands, use the mask, get vaccinated when you can, not just the children, but your family members and yourself. And that will begin to change the dynamic of this Delta variant COVID, which has been continues to be a problem here in Connecticut. Let me stop there and perhaps pass it on to some of my colleagues.
Thank you, Dr. Salazar. Dr. Ketter or Dr. Dudley?
I would just add, the state has, Department of Education has a great document that people might take a look at called Adapt, Advance, and Achieve, or the AAA. I think some of the mitigation strategies that are recommended in there, especially for kids under 12, and once again, remember, the vaccine was fully approved today, folks 16 and over. It still has the emergency authorization and is a very safe and effective vaccine for children 12 to 16. For kids under 12 who can't be vaccinated, mitigation strategies such as mask wearing, maintaining social distance, and I think we're sort of in the 3 to 6 foot range if we can, if we're inside, encouraging activities outside, all can help keep children safe.
Thank you, Dr. Dudley. Dr. Ketter, would you like to add?
Sure. I think that, as Drs. Salazar and Dudley have said, really utilizing the technology we have available to help us is really important. Vaccines have done so much, and as I talk with trainees and families, there are things that doctors in a generation ahead of me saw that I will never see because vaccines have helped us. But we think about it like Swiss cheese. The vaccine is like a really big layer of Swiss cheese, but if we add on masking and social distancing and appropriate hand hygiene, that blocks all the little spaces to try to let the virus get through, so to speak, or that opportunity. But it's really important that we do that we pace ourselves and that we work together, because this really is a social problem. We're all here working together and we all have to do our part to help. Otherwise, it's a real challenge. But by working together, we'll help get through the fatigue, we'll help get through COVID.
Thank you so much, Dr. Ketter, as well. I'm also was going to, any questions that you might see coming through the chat, feel free to just address them as you are sharing your information.
There was a question there about the emergency use authorization, and Rob already addressed it, but it is correct. The FDA has approved it, fully approved it for 16 and over. That's the initial approval for kids 12 to 15 is still under the emergency use authorization. But I do want to clarify something that's really, really important, because I get asked this question a lot, that if it's under emergency use authorization, that it's still experimental, and that's not the case. Emergency use authorization does not mean that's still experimental. The clinical trials were presented to the FDA and then evaluated by the Centers for Disease Control and the ACIP, and it was only approved for emergency use authorization after they saw the clinical trial data that it was safe and effective. So it's a misconception that because a vaccine doesn't have full FDA approval, if you get the vaccine, it's still experimental. That is absolutely not true. This is not, we're not doing an experiment. No one's doing an experiment under the EUA. Just that it takes a little bit longer for the Food and Drug Administration to go through the whole bureaucratic process of getting finalized and all the documents that need to be put in for full licensure, which was achieved today for Pfizer. I assume Moderna is going to have a similar authorization, and very shortly we'll have that full approval for kids over the age of 12. So I just want to clarify that. I know there was a question in the chat that was worth answering.
Thank you so much for that clarification, Dr. Salazar. So we're going to go ahead and move to the next question. And this one is specifically about, we have a lot of the questions that came through was a lot of the mask wearing fatigue. So a lot of the questions for our children, for the adults, for the teachers. So if you can just address with us, what practical strategies can you share with our participants to encourage children to wear masks consistently, since you have shared with all of us how important they are? So how can you share with us some practical strategies that we can actually adhere to as we're thinking about the mask wearing fatigue? So feel free to.
I think Dr. Dudley is an expert in these themes.
Dr. Dudley?
So something I talk about a lot with families. So first off, I think the past 18 months have given us the experience that children tolerate masks very well. Certainly in my exam room, certainly in my work with boards of education and with the New Britain School District, kids really do very well. Generally, I would say they do better than we do as adults at wearing their masks and keeping them on. Certainly, I think there are some things that we can do as adults to help kids make it a more fun and more engageable experience. I find that kids like to accessorize, and I find that things that make masks more fun are prints on the masks or doing some things to decorate their mask, whether that be the occasional rhinestone or glitter added. Kids really can make it a fun experience. And as adults, I think anything we can do to sort of support them in that can help. Certainly teachers have become experts at helping to remind kids and help them to tolerate them better. And I think as we find ourselves in the middle of the variant sort of outbreaks, that it's important to try and encourage kids. I know when I go to stores, I see a lot of parents who are probably vaccinated wearing masks along with their children to sort of normalize that experience, and anything that we can do to help children to do that and support them can be a big help.
Thank you so much for that, Dr. Dudley. Dr. Ketter or Dr. Salazar, anything else you would like to add?
Yeah, I just want to comment that again, I'm not saying this is easy by any means, and there will be absolutely teenagers or kids who detest the mask and we, obviously rather not have to wear a mask. But I've been pleasantly surprised when kids come into my office or here to the Children's Hospital where they wear the mask as if it was not an issue. And I think the adults make it more of an issue than the kids quite often. And I've seen 2-year-olds, I've seen 3-year-olds who walk in and they keep it on. It's part of their attire. Again, I think sometimes we, and I get it as a parent, I am a parent myself, my kids are older now, but that, sometimes we ascribe a sentiment to a child that perhaps doesn't really have. And I think if we model that behavior and create an additional barrier for transmission, if the kids actually adhere to it, in my opinion, fairly simply. Not everyone, and so I understand that. I'm sure some of the parents on this chat probably don't agree with me on that. But the majority of the kids will developmentally appropriate will actually wear the mask. And Rob, maybe you can comment on that. And why is that? Why is it easier for kids and adults, frankly, to wear these masks?
Thank you, Dr. Salazar. It actually is easier for children because children really can learn to habituate to things quite well. And I've worked with many children of all different types in the field of neurodiversity, and I have children with autism who've easily taken to learning how to wear a mask. I've had some children who've needed a little bit of extra training, but with that and with the wonderful work with their school team, they do that. And kids are really refreshing about understanding how we do these rules to help each other. So sometimes putting on a pro-social motivation is helpful. I think something else to think about too is we do train children to wear other garments, and this is just yet another garment, but this one serves a purpose of helping us during these difficult times with the pandemic. But a strategy is to make it fun. I think teachers have done a phenomenal job about learning ways to develop friendly mask reminders and checks. As I like to talk with parents, right? The power of kindergarten and preschool teachers is they know how to make the most mundane or boring things seem really fun and exciting. And that's why kids learn to do things, because we can redirect, we can make it fun. But we can also acknowledge that if a child is having a difficult time, there's always room to acknowledge that there are feelings and emotions, and it's okay to process that. It's okay to say, I don't like wearing a mask all of the time, but I can take breaks, I can plan, I can have opportunities at home to do that. And schools have been really good and thoughtful about working with children about how to arrange that, especially during meal times and appropriate transition points. I think it's just really hard because, the pandemic with the fatigue feels like it's kind of over, but it's not. And the reality is like, if there's a fire, we have to respond to the fire. And in this case, it's one of those absolutes. We know that it's there, it's helpful, but kids are actually pretty resilient. And if we give them the opportunity to step up, many and most do, especially if we acknowledge that room for emotion and try to make it fun while we're doing it.
Thank you so much. Thank you. Thank you. I see a lot of questions coming through as well. So regarding to masks. So I know that there is a lot of aspects that we want to address. So as we continue to monitor the chat, we're going to go ahead and move to the next question, which is about what we're about to do. We are entering the third school year impacted by COVID. What can parents do for their own well-being and to support their children's social and emotional health? And this is the balance. And I see a lot of the chat coming through about the adults, the parents, what can we do? It's some of our reality as well. When I'm thinking about my grandbaby that is a year and a half wearing his mask and, concerned about that. So what are some of the things that you can share with us? What can parents do for their own well-being and to support their children's social and emotional health?
Well, I'll begin with, and again, I want to acknowledge some of the comments that have come through the chat, and let me just clarify that by no means any of the three panelists are blaming parents if kids don't want to wear a mask. This is not it's not a blame game. It's really a team approach, and we're only going to get through it as a team. It's not perfect. It is not something that if Dr. Russell Tucker was designing a school year that we're going to say under normal conditions that we're going to make everyone wear a mask. No, of course not. I mean, I'd rather not have to wear it. I mean, I have been wearing it for the last 19 months, and it is difficult. It is complicated, and sometimes I really want to throw it away. So I have to acknowledge that. So, what I would say is, yeah, it sucks. There's no question about that. But we have to be cognizant that if we're going to beat this until we have fully, vaccines for kids and we get through lower transmission rate, we do have to make an effort to, follow some direction and wear those masks. And now speaking about it is reasonable. And yes, you can express your views and sometimes you're going to be angry, and I get it. And I see a lot of in the chat, a lot of concerned parents, perhaps even a lot of angry parents. And I get it. This sucks. There's no question about that. So part of well-being is recognizing that this does not make you happy. Part of well-being is having a social support with your neighbors, with people that you can talk to, and then being listened to. And I think listening to those concerns. Now, for me as a medical professional, I think part of what I can do for you is to take away what's myth, things that are not true. Because that's important, and at least guide you in the right direction of what should you be, what is the right information, what is scientifically sound, and we base it on science. This virus is not political. This virus is not against you except for getting you infected. So what is the science behind this? For instance, one of the questions that the vaccines have killed a lot of kids. That's not true. That is simply absolutely not true. Misinformation. These vaccines have been given to a lot of 12 to 15-year-olds, very safe, very effectively. Mortality is not one of those issues that has occurred. So my responsibility is to help you understand that. I think that's one way to begin to solve the problem. But I'm going to pass it on to Dr. Ketter, who's a developmental pediatrician, who I think will provide some good guidance in terms of support the children's social and emotional health.
Thank you. This has been a real challenging 18 months, and we're still going. And parenting is already challenging to begin with. Who would have thought that parenting during a pandemic was anything that anyone expected? And no one did. And then throw on top of that, trying to figure out school and distancing and trying to do things. So this is a lot of layers. It can be really hard and it can be really challenging. I think the first strategy that we always want to do is the same strategy that we do always with parenting, which is take a deep breath and try to find our own center and anchor ourselves. Because as we're trying to support the emotional well-being of children, we are their anchor. If we can find a way to ground ourselves and care for ourselves, then we can help care for them. And this is actually something that the American Academy of Pediatrics just reiterated through a policy statement that just came out. And it talks about how do we prevent what we call toxic stress for children. And the way that we do that is by promoting strong, secure, stable, nurturing relationships. That means you. That means being present and available for your child, being there to be able to help console them if they're feeling upset, being there to listen to them as they might talk about what happened during the day, being there to be excited with them. But in order to do that, the hardest part is that we have to take care of ourselves. This is like one of those moments where I think I said last year at this time, COVID feels like we're in a super slow motion plane crash at times. And, you know, when we get told the oxygen masks might come down, if we're riding with our child, we should put our own oxygen mask on first so that we can then help get it on our child. But the way that we are caring for them is by being there, by taking care of ourselves. We can be present, we can use games, we can use play, we can process feelings and emotions. And most importantly, we can try to have these moments of fun and togetherness, because that's how we're getting through it. Just because we're socially distanced doesn't mean that we have to be socially isolated. And what's really important is that we find those moments to celebrate and flip the script, so to speak, find those positive moments, find the things that really help us get through the day, find the thing that was really exciting that we did. And by doing that, we're really protecting the emotional health and well-being of our children. And that's for a good majority of kids. Also, keeping your ear to the ground is important too, because as we've acknowledged, this has been a stressful 18 months. And if you are ever concerned about your child's emotional health and well-being, please talk with your child's primary care provider or pediatrician, or talk with your school counselors. Our school teams have really had wonderful ways of connecting and working and supporting with families. This is definitely a team effort. So keep your ear to the ground, but take a breath for yourself and have fun with your child when you can. Celebrate those moments.
Thank you so much for that, Dr. Ketter. Dr. Dudley, do you have anything else to add? Yes, thank you.
So I think certainly over the past, since January and even before that, something that I've seen as I do well child visits on my kids is just an enormous uptick in anxiety disorders and depression. And I think that we're really seeing that the stress of the situation of the pandemic is really affecting our kids. So I think what Dr. Salazar and Dr. Ketter said in terms of being there for your kids, taking the time to talk to them and realizing that you do know your children best. If you see signs that things that their emotional health is not in line and that they're having trouble or are struggling, reach out to your pediatrician, reach out to your school psychologist, reach out to their teacher, and know that there are systems and folks there that are ready to help. I know that kids have just totally, their social nets have come apart. And I think one of the reasons why, when I see questions in the chat about bringing kids back to school face to face, when we all talk about the risks of that, I think what we've come to understand in the past year is that the costs on their social and emotional side of not having that socialization are great enough that with proper mitigation strategies that we've learned over the past 18 months, that we think we can do it. And I think Connecticut has been a leader in bringing kids back and bringing them back safely, but that's incredibly, incredibly important. So please, if you do feel like folks are having trouble, do reach out to your pediatrician or the school psychologist or your school-based health center, because help is there.
Thank you so much for that. Thank you. So I see some of the questions in the panel saying, and the chat asking about this. They thought this was an interaction question and answer. So what we're asking is for you to put some of your questions in the chat. We are trying to manage over 1,200 participants. So we want to make sure that your questions are answered. And this, we might not be able to get to every single one of your questions. Most likely we will have another house call to be able to address some of your questions as they come in. But I just want to make sure that we address that. And our expert panelists are monitoring the questions as well. Dr. Ketter.
Thank you, Ingrid. Just to comment on some of the questions that are coming in are very specific. And just as a reminder, we are not providing specific medical advice for your child. That's a conversation that you should have with your child's doctor or primary care provider who knows their medical history. This is what we call kind of a public health forum. And what we're trying to do is answer some of the questions and demystify some of the myths around things that are going on, but also to think about what are the general strategies that work for most. But remember, we're not providing specific medical advice. So if you do have a question, please reach out to your child's primary care provider.
Thank you so much for that clarification, Dr. Ketter. Thank you. So let us move to the next question that it came across through a theme across many of the questions that we've seen coming through is, from your perspectives as pediatricians, how has the pandemic impacted other aspects of children's health? What is the best advice for families to support children's overall health? So that's a two-part question. So if you would like to share with us, please.
I will, let me answer the question, and also, some of the messages that are coming through the chat. And I do want to first emphasize that COVID-19 has affected children on the medical side quite significantly, actually. And again, this is not about fear, but it's about prevention. So nationally, over 4 million children have been affected by COVID-19 of those that have been tested. Sadly, we have seen close to 400 deaths in the pediatric age group, which is several-fold higher than what we see in any given year for any of the other vaccine preventable diseases. And that's important to understand. In addition, we're just beginning to understand the long-term complications of COVID-19 in the entire population. So, we have close to 40 million Americans now that have had COVID-19. Again, 4 million children. And even those with mild disease, we don't yet know exactly what the outcome is going to be 3 months, 6 months, or 9 months from now. So as a parent, as an uncle, and as a friend and a colleague, and I want to prevent infection as much as I can. I think it's really, really important, in my opinion. And there are many strategies that we have to use for prevention of infection, because I want to prevent COVID-19 in kids as much as I can. I want to prevent deaths in children as a result of COVID-19. I also want to prevent the long-term consequences of which we yet don't know what they are. We're just beginning to learn. That's something called a long haul syndrome, including the multi-inflammatory syndrome, which is something that affects kids who've had mild disease and then end up in the hospital. So it is important for us to use all these strategies to prevent infection as much as we can. Now, that's on the one side. I agree with you, some of you who said that this is a mild disease in kids, and that's good. I mean, we're lucky that the majority of kids will have a mild illness and are not affected as much as the elderly, who had a very high mortality rate as a result of COVID-19. But what is not true is to say that this is a disease that is completely it doesn't cause any problem in children. I think we have to prevent it. This is why we use the mask. This is why we're developing the vaccines. It is science-based. It is something that it is important for us to prevent. Now, related to the question and that is on the chat here, that as a pediatrician, how has the pandemic affected other aspects of children's health? I mentioned in the beginning that here at Connecticut Children's over the past year, we have seen a significant increase in mental health issues that are related to COVID-19. And some of that obviously streams from isolation, some streams from fear, anxiety, school stressors included that have, and all of that's related to the environment that we're all living in. It is a very difficult, stressful environment. There's no question about that. And mental health has been perhaps one of the biggest issues related to teens in particular, but small children. We got to pay attention to that. And that's something that Rob alluded to, both Robs alluded to. And certainly that's one of my major concerns is how do we help our teenagers in particular to make it through this very difficult time. And that's something we got to pay attention to.
Thank you so much, Dr. Salazar. Dr. Dudley or Dr. Ketter?
So one other aspect of this that I've seen is just a dramatic increase. So when kids were remote learning, they weren't getting the exercise that they normally get moving around buildings, going back and forth to school. They were probably snacking, as I was, a lot more, as probably as many of us were, a lot more, because that refrigerator is very close to where I was sitting with the computer, and it was just too easy to sort of graze throughout the day. So one of the real serious things that I think has come out from the pandemic that's separate from the infectious disease stuff and the mental health stuff is obesity. We were already struggling as a nation with really having a very high rate of overweight and obesity, with childhood diabetes and fatty liver disease sort of becoming more and more prevalent every year. We were just, I think, beginning to start to turn that curve as a country, and then COVID hit. And in a matter of months, I had seen higher levels of prediabetes than I have. I used to refer 1 or 2 kids every 6 months to the Children's Hospital for assistance, and I was referring throughout the spring 2 or 3 kids a week. So I think things that we can do as parents, I'm seeing a lot of comments about healthy, fresh air, and I think we all agree outside exercise is a great way to stay safe, is to get our kids outside and play. You know, the weather is still pretty good once we get past the hurricane. The weather is still nice outside. Kids can get outside. I like to think too about combination strategies. So one of my favorite strategies for families is what I call the walk and talk. If your neighborhood is safe and you're able to take your kids out and walk around the block, take them outside for a little exercise. It's good for you. It's good for them. It'll help to sort of help them burn off some of those calories, but talk to them while you're doing it. So find out how their day went. So as we talk about building up resilience in children, a lot of that has to do with us as parents just communicating and leaving open roads to communication to hear sorts of things, what's gone on in their day, what are their worries, what are their concerns, and just let them talk. And I find that that is a very successful strategy, both for incorporating exercise and also for getting a feel where their mental health is.
Thank you, Dr. Ketter.
Something else that we also want to pay attention to is sleep for children. The change in routines and that disruption has really altered kind of sleep architecture for children. It's also changed how much time we permit access to media. And we understand that media is kind of a thing that's here, but media is just like food. It's not about whether or not you have it, because just like food, it's part of our diet. What is important is that we think about healthy media consumption, that we still continue to keep an eye on what our children are consuming. There are some really wonderful resources out online like commonsensemedia.org, or you can visit the American Academy of Pediatrics, healthychildrenandfamilies.org, to make a family media use plan. I think that even with everything that's going on, we want to schedule some time to be down from electronics and to step back. A challenge for children in this new millennium is learning how to be bored or how to just be in a slower pace. And I think that that's something that we want to do, create opportunities for mindfulness and for stillness. And remember that all of these discussions, comments, and other things that we do really do promote that emotional and mental health and well-being starting at an early age.
Thank you so much, Dr. Ketter. So I'm just going to ask our panelists if there's any other questions that you see in the chat that you would like to address. I have one that I have started I would like to bring to your attention, but I wanted to give you the opportunity to see if there's anything that has been sent directly to you that you would like to address.
I know I saw some questions going on about physicals in the chat box. One thing the Academy, the American Academy of Pediatrics really wants to emphasize, and I think we all know this, that when we were in lockdown back in the spring of 2020, a lot of kids missed their well child visits, both for vaccines and also for screenings. It's really important to try and get your kids in to catch up on those if you haven't. I know a lot of families have been able to. Practices in general are seeing folks in person now, both for the purpose of getting their vaccines up to date, but even more importantly, all of those other sorts of screenings that we do, hearing screening, vision screening, mental health screening, all of those things are very important. And I think as the pandemic has put folks at risk for all of the things that we've talked about on this call, a well visit can help to screen for many of them.
Thank you so much, Dr. Dudley. Any other questions that you would like to answer? So Dr. Ketter, go ahead.
I know that there's a lot of questions going on, like why this decision, why that decision. A real opportunity that we have to work with our children on has been the theme of 2020 and 2021, and maybe 2022, which is what we call cognitive and emotional flexibility. It's about learning to roll with the data and the punches and how to respond. Just kind of like we learn safety behaviors like stop, drop, and roll when there is a fire. We also learn how to recognize when a fire exit might be blocked. We learn how to check the door handle for its temperature, and we learn how to respond and kind of answer it in that moment. So there's a lot of moving pieces, and a lot of moving pieces makes my head hurt an awful lot because the brain just really isn't programmed to handle all of that many moving pieces. There's also a lot of information out there, and I invite you to have informed conversations. Part of our goal for all of us being here is to help give evidence-based information so that we can help people understand and make informed choices and really reduce the risk for children and for their families. I've done a year and a half of telehealth visits and seen some families in person too, but being on telehealth has allowed me to see into the homes of what children and families are experiencing. And this hasn't been easy. And there have been family members who've been sick. I've worked with children and families who've had family members die from COVID. I've had parents on visits with me on supplemental oxygen after they were discharged home from the hospital. This has been a hard year for everyone. And I know that triggers this internal sense of anxiety, what next? But I think that what we really want to do is just respond by helping each other and really checking in, really emphasizing that this is kind of a social contract behavior. And the more that we all step in and say, sure, we got this, what next? Is how we're going to help and get through it. So I know everyone is really anxious about the unknown. Tomorrow is unknown, but what we are doing is we're using the best tools that we have, that science has, to make evidence-based and informed decisions so that we can be safe. And part of science is recognizing to respond to the data in the moment. And what's been really amazing is seeing how the scientific community, how the medical community, how all state legislators and educators and everyone have been coming together to really think about how we do this and how we do it effectively. And that's been part of the data that we've seen with Connecticut. So we're 18 months in, we still have a while to go, but we're getting there.
Thank you so much, Dr. Ketter. Dr. Salazar?
Yeah, Ingrid, and there are a lot of questions here, which obviously we're not going to get to. And I appreciate everyone's comments. And I think what's important for us to do over the next few weeks or months is to really continue to monitor COVID-19 in the state of Connecticut. I think it's got to be very specific. And if there's something we have learned over the past 18 months is to pivot, to change, to listen to you. And as the pandemic changes, we have to maybe sometimes go back to prior school years policies where, if we have numbers that suggest that the Delta variant is really rising or increasing rapidly in a younger population or in the school districts, I think, we will look at it. I'm sure the Department of Education will use it, and the Department of Public Health will analyze the data. And if we need to go back and change things, I am sure that will be done. I think Connecticut has done a very good job in trying to keep everyone safe. Is it perfect? No. But can we look at numbers, look at data? And let's say one number that I look at all the time is the percent positivity rate. Right now in the state of Connecticut, it's about every 100 tests that we give for COVID-19, about 3% of those are coming back positive. If, let's say, we started seeing that went up to 10, 15, 20%, then the whole dynamic changes, because we have to go into mitigation strategies to try to change this. And in a situation like that, we may have to go to a hybrid model. At this point, the rates are still fairly low. The rate of vaccination in the adults is fairly high in Connecticut. And I'm hopeful that the 12-year-olds and above will continue to get vaccinated at a higher rate than they have been so far. If we do all those things, we may be able to continue the school year the way it is. But it is something we have to monitor in real time. And it's not that people are not trying to do it. It's just that it's complicated, it's difficult. And so I sympathize with each parent. The anxiety you're feeling is something that I can palpate, I can see it, I can read it in the comments you're making. it makes it very difficult. So hang in there as much as you can.
Thank you so much for that, Dr. Salazar. And you actually began to answer one of the questions that it was posted in the chat that I have marked for myself, specifically to address with all of you regarding the fact that the outbreak happened in Florida. So another question. So as children go back to school, as this, what happened in Florida, is how do we in Connecticut, what can we do in Connecticut so that doesn't happen here? Because now we are sending all of our students back in school full time. So what are some of the things that we can do? And you began to talk about the mitigation and the science and looking at the data. So I don't know if any of you would like to add to that as well, because that's a fear for all of us as parents. And, we're going to send our children to school. And now what happens if this is huge outbreak happens? So how do we mitigate for that?
Yeah, and again, I mean that can happen. I mean, we have to be we have to be transparent and real. And schools haven't opened here yet. They're about to open in a few weeks, or maybe just in a week or so. I think that's when school year starts. And I think we have a lot of testing we need to continue to do so that kids with with symptoms need to be tested. That needs to be reported. The health department has been very good at understanding where those potential outbreaks occur, and then we need to move quickly if we do see the uptick and begin to change things. It's got to be real. This cannot be something that and I don't think there's any intent or need to hide numbers. But if those numbers can increase in a certain school district, we may need to change the model for that school district and be nimble and be ready to act on when things do change. We do have the winter months coming also, and we'll have influenza. Just as a reminder, a flu vaccine is really important for all the kids as well. That is approved for kids over the age of 6 months, and that's something you can also do to mitigate respiratory disease being transmitted. I do believe, frankly, that the masks are important as much as that can be used, and realizing that in some kids it may be very difficult. I do appreciate that. But that combination of monitoring, testing, not coming into school if your kid is sick, keeping him at home, it's very, very important. Influenza vaccination, and hopefully when vaccines are available for the younger population, then using that. If we do all of that, I think we'll get through this, although it will be difficult, I have to admit.
Thank you so much for your transparency as well, Dr. Salazar, and your direct answer in this, the concerns of the parents, as we can see from the questions in the chat. Yes. Dr. Ketter?
Sure. I know that there have been some comments on equity with decisions in the decision-making process. I think we want to be very thoughtful and cautious because there have been a lot of vulnerable individuals who've experienced even more challenges during the pandemic. Remote learning does work for some children. It does not work for all children. And we've actually seen some challenges that there are some children with disabilities who just remote learning is not an ideal or effective option for them. Also, for what we've seen, we've had families who are single working parents who are essential personnel. And what do they do? How do they juggle childcare? How do they help manage remote learning? The pandemic's really created a whole set of new problems, and it's really hard to take into consideration all of them without having some of the perspective. And I've been really humbled to work and walk with families to see what they've been experiencing. So I really can say what I think is happening is people are taking some thoughtful considerations. And like I said, if you have particular concerns about your child, talk with a medical professional to help better understand how that might work. Also talk with your child's school and school team. But there is a certain degree of, if the building is on fire, we have to respond to that fire. And it really doesn't feel great. Another thing that I've said is, normally I don't like walking through windows, but if you're in a building that's on fire and your path of egress is a window, sometimes we have to do that. And I think that we've seen some really nice opportunities, seeing the scientific community come together to provide a vaccine that has been our fire truck with a ladder has been really effective. And, hopefully as we continue to do safe research and look into how this will work for children, it will help provide us the peace of mind. But in that same time, while we're waiting, we want to keep taking care of ourselves, keep checking in on one another, keep talking with one another, keep supporting, and first and foremost, be kind. I think it's really challenging because everybody is anxious. When people feel anxious, sometimes that turns into barking or yelling or biting. And if we just take a moment and listen, it's an opportunity that we can try to help each other as we're going through the emotional duress, because it's been a crazy 18 months. But with that kindness, we'll help support each other as we get through it.
Thank you so much, Dr. Ketter. Thank you. So I'm being conscious of the time, and I do understand that a lot of questions have come through. And for the participants on the call, we receive hundreds of questions, as we mentioned at the beginning. And there is a lot of the questions that have been asked, and a lot of them are very specifically, very personal in nature. And as our experts have mentioned, those are the ones that you want to directly have conversations with your child's pediatrician, your doctor. As we come, before we bring this conversation to an end, this house call, any particular messages that you would like us to listen from your perspective, advice that you can give us, as you have answered these questions and you have looked at the concerns that are coming through the chat, any last words that you have for us so that we can actually process the information that you have provided?
I'll start, Ingrid, and I want to go back to vaccines, and obviously we don't have them yet for kids under 12, and I'm hoping that they will come soon enough, and I will recommend them once I see the data for the 5 to 12-year-olds and even younger. The question has come up whether vaccines, and there were a number in the chat, whether vaccines are truly effective. I saw a figure which was really very clear, and the figure, and this is for the entire population, it's not just for the kids, but we've had close to unvaccinated Americans, over 600,000 have died from COVID-19. If you look at vaccinated Americans, the number is no more than a couple of hundred. So you're comparing unvaccinated, 600,000 of our fellow citizens have died. Vaccinated, less than 200, very few. That to me is a very important figure. And now with kids it's going to be different because the disease is less severe. But again, I want to emphasize that these vaccines do work. They're not perfect. So I would recommend that if you haven't been vaccinated, please do it for yourself, do it for your kids, so that you're not one of the 30, 35-year-olds who end up in the hospital very sick, and then your kid doesn't have you anymore. I cannot emphasize that enough. So please get vaccinated.
Thank you so much, Dr. Salazar. Dr. Dudley or Dr. Ketter, any final words for us?
Guess what I would say is get vaccinated if you can, and get your children vaccinated when it's possible, and wear your masks and try and be supportive of them. I know it's an incredible stress on families. If we work together as a team, your teachers, your pediatricians and medical providers, your mental health providers, we can form a supportive network for our kids. We can help them succeed, and they can do okay. I know from the Department of Public Health and from the State Department of Education, where I sit in on conversations where many of the things that are being discussed get decided, that folks do care. They are taking a look at the numbers and they are watching. Decisions are not just being sort of spun out. And I know that's sometimes hard and it's stressful when folks are in an environment where everything is changing rapidly. But I think the fact that things do change should be evident to everyone that things are being considered and what's occurring is being reacted to.
Thank you so much, Dr. Dudley. Dr. Ketter.
It's been 18 months and we are all getting tired, but we're working to get through that end that's in sight. And as we're hoping, as my colleagues here have said, once we can see that the vaccine is proven to be safe for young children, as it's been proven to be safe for older children, we'll be able to move further and further towards the finish line of what we're hoping for. But most importantly, as we're dealing with all the stress, we want to be there. The way that we're going to help support our children is by providing and maintaining those strong, stable, nurturing, supportive relationships, by being there, checking in with them, asking how they're doing, talking and processing emotions and feelings, things that we do every day, but also having those moments together. I think that as we work with this, we're all working together, but the more we help each other, the more we'll find that we're helping ourselves too.
Thank you so much. I wanted to express my deepest gratitude to all of you. It is that time at 6 o'clock. I know how busy you are during this time, and for you to take the time to be able to address some of the questions and concerns that were submitted to us and those ones that came through the chat to all of you. So thank you so much for giving me the opportunity to facilitate this conversation and learn so much from all of you. So thank you. I will now give my colleague, John Frassinelli, the floor back. As we come to an end of the session. Thank you to all of you. Really, truly appreciate it. Thank you. John?
Thank you, Ingrid. Thank you so much. And thank you, Drs. Dudley, Salazar, and Ketter. Really appreciate your time this evening. And thank you, Ingrid, our partners at CERC, for all your work. I want to also acknowledge Dr. Carson, who is also here helping out. Judging certainly by all of the comments in the chat, we know there's a lot of passion around these issues. We appreciate your time in participating tonight. We're going to continue to hold these as there continue to be more questions. One question that I do want to address is that I know there are a number of questions around remote learning. Please know that currently there is no remote learning option for the coming school year based on statutes and the laws that were passed by the General Assembly. So we are working with districts so that districts develop local policies to support remote learning in situations where students have some specific needs around special education needs and around some disabilities. So that is happening. But I wanted to acknowledge that there were several questions about remote learning. And districts have been provided with some guidance from the department around remote learning. So again, I want to thank all of our partners. Really appreciate your time tonight. And for the 2,800 of you and the other folks who are on YouTube, we hope you found this helpful, and we're going to continue to have conversations in that regard, because it's not necessarily going away. And we all, as Dr. Ketter and all of our doctors said, it's not a sprint, it's kind of a marathon. So we'd like to continue to work together to support each other. So thank you.
Thank you. Have a good evening, everyone. Thank you.